Hello everyone. Today in our series of Docplexus KOL interviews, we have with us Dr. Suresh Chari, who is the Professor of Medicine at Mayo Clinic, College of Medicine. He has been the Director of Pancreas Clinic at Mayo Clinic, Rochester, and the past President of the American Pancreatic Association. He has been the Counselor of International Association of Pancreatology and is the President-elect of the IAP. His current project, Pancreatic Cancer-Induced Diabetes, a clue to its early diagnosis, has the long-term pragmatic goals to facilitate early detection of pancreatic cancer. Thank you, Dr. Suresh, for joining us. The first question that I'd like to ask you is, why is the development of early detection biomarkers crucial for the diagnosis of pancreatic cancer?
So pancreatic cancer, at least in the developed world, is fast becoming a common cause of cancer-related death. For example, in the United States, today it's moved up to being number 3 cause of cancer death in the United States from just number 5 a couple of years ago. This is partly happening because of the increasing incidence of pancreatic cancer. That is, the number of cases is increasing every year. And the mortality still remains dismal, with 94% dying within 5 years. So most of the other cancers are coming down in their incidence, like breast cancer, colon cancer, prostate cancer, and all of these cancers have an early detection program. And we believe that there's going to be no impact on mortality in pancreatic cancer unless it's detected early. So that's why we so strongly believe that early detection program in pancreatic cancer is the way forward.
So you mentioned about early detection. So how can the early onset of diabetes and hyperglycemia be used as a detection marker for pancreatic cancer?
So this is something we have been studying for the last 20 years. When I was doing my training, I saw that nearly half the patients with pancreatic cancer were diabetic. And the question I've had for the last 20 years is, how do I translate this clinical observation into something that can be useful to the patient? And the observation that we made over the course of the last couple of decades is that the diabetes starts a year or 2, 3 years before the cancer diagnosis. In fact, it's the only clue the cancer gives to its presence before it actually becomes symptomatic. And once it becomes symptomatic, it's too late. So we believe that the window of opportunity that is there between the onset of diabetes and the diagnosis of pancreatic cancer is enough to make a difference in the stage of the cancer at which we will detect it and what treatments we can offer to patients if detected. So that's why the early onset diabetes in patients over the age of 50 seems to be a good group of subjects in which to look for early detection of pancreatic cancer.
So you mentioned about the window of opportunity, but is it preventable? The pancreatic cancer can be prevented in diabetic patients, and if so, what are the prevention measures that can be taken?
So there are 2 parts to this connection between diabetes and pancreatic cancer. One is that if you have long-standing diabetes, like diabetes for 10, 15, 20 years, you are at increased risk for pancreatic cancer. And that risk is similar to that of smokers. It's not very high. That's the group in which you think that some kind of a prevention might be helpful. The kind of diabetes that we are looking at is actually caused by the cancer. So we believe that by the time you have diabetes, the patient already has cancer. What we are trying to do is early detection of the cancer, not in a pre-cancerous stage that we can prevent it from progressing. So I don't think our strategy is directed towards prevention, it's more towards early detection.
So do patient-specific factors like smoking, diabetes or hyperglycemia complicate the implementation of new treatment strategies for pancreatic cancer?
Good question. We believe that the diabetes in pancreatic cancer should be treated like any other diabetes with the same medications. And so as far as we know, the treatment for pancreatic cancer should not be impacted by the presence of diabetes and other things. Do any of these factors increase the risk of pancreatic cancer in diabetics? Probably, but these need to be further studied.
So moving on to the treatment of pancreatic cancer, are there any vaccines available for the same?
There is a vaccine that's FDA approved, but its widespread use is very limited at this point. And there's intense work going on in immunotherapy for pancreatic cancer, but there's nothing that's mainstay or mainstream treatment of pancreatic cancer.
So would you like to conclude that immunotherapy is a better treatment option for pancreatic cancer?
Not yet. I think there are chemotherapies available that are quite effective. Whether immunotherapy in future will become even more effective or will be a good adjuvant to chemotherapy is something that intense work is going on now. But at this point, immunotherapy is not the first line treatment.
So since there is a lot of research that has been taking place in United States or Western countries, do you think it is applicable to the Indian context?
I don't think so. The pancreatic cancer is not very common in India. In fact, it's one of the lower incidence rates for pancreatic cancer. That could be because the population is generally younger, and therefore it looks as if pancreatic cancer is not common. As the general overall age of the population increases, and as the older population gets larger in number, we'll start to see more. And diabetes is very common in the young in India. How all that impacts what we are trying to do is something that we don't know yet. If you find a marker for why the cancer causes diabetes and we apply it to diabetics and we are able to tell type 2 diabetes apart from this diabetes, then we'll make a breakthrough and it can be used. But at this point, I don't think it's directly applicable.
So can you elaborate on any recent breakthroughs in the treatment of pancreatic cancer?
I think the biggest breakthrough has been this couple of combination of drugs that have made a significant impact. One is called FOLFIRINOX, that's spelled FOLFIRINOX. It's a combination of multiple agents, which has a significant benefit in terms of reducing tumor size and improving resectability. Another one is called gemabraxane, which is a combination of two drugs. These two appear to have made a difference in our ability to shrink the tumor and take patients to surgery, which we previously could not. Both are toxic. Both cannot be used by elderly people. So there is still room for improvement. But in young, fit patients who get pancreatic cancer, these drugs are making a difference.
Is there any message that you'd like to give our doctors community?
Well, I mean, diabetes is a huge problem in India, and anything that can be done to educate the population about dietary changes that would be beneficial, exercise, taking drugs on a regular basis. It's very common in India to say that I don't have any symptoms, so I don't have to take treatment. So education about the fact that asymptomatic diabetes can also be a killer and all these things. There's a lot of education that needs to be done apart from obviously changing lifestyle risk factors and making drugs available to every class of society. So,
thank you so much, Dr. Suresh, for sharing your valuable expertise on Docplexus.
You're welcome. Thank you.
Thank you. To stay updated on our latest scale videos and interviews, please follow us on Twitter, like us on our Facebook page, and subscribe to our YouTube channel. Happy Docplexing!